think for a moment about all that data buzzing around online. Now, narrow that down to maybe the most personal stuff. Your health information.
Mhm.
It's this whole hidden world, really, with some complex rules keeping it safe. And, well, today we're diving into that.
Exactly. We're going to look at, the methods they use to protect it, how laws like HI Tech have really shaped things,
Right.
the whole journey of electronic health records or EHRs, and the big ethical questions, especially with things like telehealth becoming more common.
And we're basing this on some really solid groundwork detailed notes from chapters 5 and 8 of Nursing Informatics and the Foundation of Knowledge.
Yeah, it's quite comprehensive.
To think of this as us pulling out the absolute must-knows and maybe some surprising bits.
Yeah, our goal is pretty simple, really. Just clarity. This stuff affects everyone, whether you work in healthcare or not.
Uh-huh.
We want to cut through the jargon, and just get to the heart of how your digital health info is managed and protected.
Okay, so let's start there. Protecting healthcare data. It's not just like one password, is it? It sounds like multiple layers are involved.
Oh, definitely not just one thing. Think of it like securing, I don't know, a fortress. You need multiple layers of defense.
Okay.
The first layer, and one we all kind of interact with, is access controls.
Right, like passwords, maybe fingerprint scans.
Exactly. Passwords, biometrics.
Yeah.
But a really key part of this is role-based access.
Role-based. What does that mean exactly?
It means people only get access to the specific information they absolutely need to do their job. So a nurse giving direct care has different access than, say, someone in billing.
Ah, okay. So you limit who can see what.
Precisely. It helps limit the damage if, an account gets compromised or
Yeah.
someone makes a mistake. It minimizes the scope.
Makes sense. What's layer 2?
Then you got encryption. This is crucial.
That's like scrambling the data, right?
Basically, yeah. Turning
Yeah.
it into code so that even if someone intercepts it, they can't read it without the specific digital key. And this applies both when data is moving in transit, like an email between doctors, and when it's just sitting there at rest in a database.
So it's protected whether it's moving or stored.
Correct. Think of it like a digital sealed envelope.
Got it. And what about like viruses and hackers trying to get in from the outside?
That's where your firewalls and antivirus software come in. They're kind of the gatekeepers.
The first line of defense.
Exactly. Firewalls monitor the traffic coming in and out, blocking suspicious stuff. Antivirus is constantly scanning for malicious software already inside or trying to get in.
Okay, so access control, encryption, firewalls. What if something still goes wrong? Or maybe someone inside makes a mistake?
Good question. That's where audit trails are vital.
Audit trails. Like keeping a log.
Precisely. They're detailed digital logs of who accessed what data, when they did it, and if they changed anything.
Ah, so you can track activity.
Yes. It's essential for spotting misuse, like someone snooping where they shouldn't, but also just for tracing errors. If there's a mistake in a patient's record, the audit trail helps figure out how it happened.
Okay, that accountability piece sounds really important. Now, all this tech is great, but what about the people using it every day? The doctors, the nurses?
You've hit on probably the most critical point, the human element.
Right.
You can have the best tech in the world, but if people aren't careful, it doesn't matter. That's why ongoing training and awareness are absolutely non-negotiable.
Training on what specifically?
Understanding hypo rules, definitely, but also practical things like how to spot phishing emails.
Oh yeah, those are nasty.
They are, and they're
Yeah.
getting more sophisticated. Also, just secure practices for documenting patient info. It's about building a security-conscious culture. Everyone's responsible.
Because one person clicking a bad link could potentially compromise a lot.
Unfortunately, yes.
Yeah.
That weak link can bypass a lot of the technical defenses.
And the notes also mentioned risk assessments. What are those for?
Regular risk assessments are proactive. It's about systematically looking at your systems and procedures to find potential weaknesses before they get exploited.
Like a security checkup for the whole system.
Exactly. Find the vulnerabilities, fix them, and strengthen your overall defense.
Okay, so it's a mix of tech, people, and constant vigilance. Let's switch gears a bit. You mentioned HI Tech earlier. How did that 2009 Act really change things for HIPAA?
I think it was a huge deal for HIPAA, the biggest impact. It dramatically strengthened the penalties for violations and data breaches.
So bigger fines, basically.
Much bigger fines, and also increased enforcement activity. It really put teeth into HIPAA and made organizations take data security much more seriously. The stakes got higher.
Okay, more accountability. What else did HI Tech do?
It also significantly expanded patient rights regarding their own electronic health records, their EHRs.
Oh, so?
It made it easier for patients, for you, to get electronic copies of your medical records, for example. It pushed things towards being more patient-centered.
Giving patients more control over their info. I like that. And wasn't there something about telling people if their data was breached?
Yes, absolutely. The breach notification rule, that's a cornerstone of HI Tech.
Okay.
It mandates that if there's a breach of unsecured health information, the hospital or clinic has to notify the affected patients.
Makes sense.
And if the breach affects 500 or more people, they also have to notify the Department of Health and Human Services, HHS, and often the media as well.
Wow, the media too. So it forces transparency.
Exactly. It brings significant breaches out into the open, which is crucial for maintaining public trust, or at least informing the public when trust is breached.
Right. Now, HI Tech also seemed to push for EHR adoption itself, didn't it? How did that work?
It did. A big part of HTech was creating incentive programs, basically paying doctors and hospitals to adopt and meaningfully use certified EHR systems.
Meaningful use. What did that involve? We'll get to that, but the incentives were key.
Yes, the financial incentives were a major driver behind the shift from paper charts to electronic records across the U.S. It really accelerated EHR adoption.
So Heyday Tech beefed up the rules and pushed the technology the rules were meant to protect. Interesting dynamic. How does all this land on, say, a nurse working on a hospital floor day to day?
The impact is massive. Nurses are right there constantly interacting with electronic protected health information, or EPHI.
Okay.
So they have to be incredibly diligent about safeguarding that info in everything they do, documenting care, sending messages to colleagues, even during shift handoffs.
It's woven into every task, really.
Absolutely. And they need to clearly understand the breach reporting procedures.
Right.
What do you do if you suspect a breach? This is especially vital in less traditional settings, too.
Like home healthcare.
Right.
Or using tablets.
Exactly. Home healthcare, using mobile devices. These create different kinds of risks.
Hmm.
A lost phone, an unsecured tablet.
Yeah.
The reporting protocols are critical.
Yeah, losing an unencrypted device could be a huge problem.
Huge. And nurses also play a role in participating in security audits and, importantly, speaking up if they see potential violations or weaknesses in the system. They're often the eyes and ears on the ground.
So they're not just using the system, they're part of maintaining its integrity. Okay, let's unpack that term you use, meaningful use.
Yeah.
What was that program all about?
Right. Meaningful Use, or MU. This was a program run by the Centers for Medicare and Medicaid Services, CMS. The main goal was to promote the effective use of EHRs to actually improve patient care.
So it wasn't just about having an EHR, but using it well.
Precisely. Using it in ways that led to better health outcomes.
And I think you mentioned it came in stages.
Yes, rolled out in 3 stages.
Yeah.
Stage 1 was about basic data capture and sharing, getting info into the EHR and sharing it securely.
Okay, step 1?
Stage 2 focused on advanced clinical processes, things like e-prescribing, patient portals, incorporating lab results electronically.
Using more features.
Right. And Stage 3 aimed higher, focusing on using EHR data to achieve improved outcomes, like better population health management and demonstrating quality improvements.
So a gradual push towards more sophisticated use for better results. Now, how did this connect to, I think the notes mentioned CHP and Macari. Did meaningful use go away?
It did, essentially. The CHP Reauthorization Act paved the way for MARA, the Medicare Access and CHP Reauthorization Act. And McCarr brought in a new system.
Okay.
It replaced meaningful use with something called the Merit-Based Incentive Payment System, or EAMIPS. This is part of the larger quality payment program.
So MU out, MAPS in. What was the big difference?
The fundamental shift was moving away from just incentivizing EHR use itself and towards using EHRs to achieve and report on quality-based care.
So the focus shifted from using the tech to the results you get with the tech.
Exactly. It's less about checking boxes for EHR functions and more about demonstrating how you're using the EHR data to improve quality, safety, and efficiency.
And what does that mean for nurses now under Lou?
It means the data they enter into the EHR is even more critical.
Mm-hmm.
They're expected to document and use that data for things beyond just direct patient care notes.
Like what?
Things like tracking data for quality improvement projects, identifying patients for preventive care outreach, contributing data for population health analysis. Their documentation directly feeds into these quality measures.
So the EHR becomes a tool not just for recording care, but actively improving care system-wide. Okay, let's pivot to some potentially tricky areas. The legal and ethical side of EHRs. First big question. Who actually owns the electronic health record?
That's a really common question, and the answer is important. Legally, the EHR, the system, the database, is owned by the healthcare provider or institution that creates and maintains it.
So the hospital or the doctor's office owns the record.
Correct. They own the container, so to speak.
But what about the information inside it? What rights do I have as a patient?
That's where IPA gives patients significant rights. While you don't own the chart itself, you absolutely have the right to access the information in it. You have the right to request corrections if something's wrong. And you have the right to get copies of your records. Okay, so ownership of the record versus rights to the information, that's a key distinction.
It really is.
Now, having all this incredibly sensitive data digitized,
Yeah.
what are the big privacy worries?
Well, the digital format brings huge advantages, but also risks. There's always the risk of unauthorized access, whether it's someone inside the organization snooping
Right.
or external hacking attempts trying to steal data, which is a constant threat. And there's also the risk of data misuse, using information inappropriately, even if the access itself was technically allowed.
And ethically, what's the burden on nurses and doctors here?
Ethically, it's immense. Healthcare professionals have a fundamental obligation to maintain patient trust. A huge part of that is ensuring secure documentation and sticking to strict limits on who accesses data and why.
Meaning, EHRs should only be accessed for legitimate patient care or essential operational needs. Accessing records out of simple curiosity, for example, is a major ethical and often legal violation.
Yeah, just looking.
Absolutely not. That trust is paramount.
And if someone does cross that line, what are the legal consequences?
They can be really severe. For the organization, there can be massive HIPAA fines. For the individual nurse or doctor, it can mean disciplinary action from their professional board, potentially leading to suspension or even loss of their license.
Wow, so it's career-ending stuff, potentially.
It definitely can be. And beyond that, nurses also have a role in advocating for strong security policies where they work and just being incredibly discreet when discussing patient information, whether verbally or digitally.
Right, vigilance all around. Okay, let's zoom in on a specific specialty. Nursing informatics. How does the ANA, the American Nurses Association, define what that is?
The ANA defines nursing informatics as a specialty that blends nursing science with information science and analytical sciences.
Yeah.
The goal is to manage and communicate data, information, knowledge, and wisdom effectively within nursing practice. Basically, using tech and data smartly to improve nursing.
Using tech smartly. What are the core skills or competencies someone in nursing informatics needs?
There are several key ones. Data management is fundamental, ensuring data is accurate, secure, usable. Also, system optimization, making the IT systems work better, more efficiently for the users.
Making them less clunky.
Exactly. Usability is huge. Another core area is integrating clinical decision support tools into EHRs.
What are those?
Tools that provide evidence-based prompts or information to nurses right when they're making decisions about care, like flagging potential drug interactions or suggesting best practices.
So tech helping with clinical judgment.
Precisely. They also get involved in selecting and evaluating new health IT systems, making sure they actually meet clinical needs. And as I mentioned, focusing on system usability is critical because a system that's hard to use can actually lead to errors and impact patient safety.
Yeah, if it's frustrating to use, people might take shortcuts. What kind of jobs do nurse informaticists actually do?
All sorts of things. They might manage system implementations, rolling out new software. They often provide training and support to other nurses and staff. Many are involved in data analytics, looking for trends and workflow redesign, figuring out how to use technology to make clinical processes smoother and safer.
So they're kind of the bridge between the bedside and the technology side.
That's a great way to put it, a crucial bridge.
Okay, let's broaden out again to ethics across all of healthcare informatics. What are those fundamental responsibilities everyone has in this digital age?
Well, the core ethical duties don't really change. They just apply in a digital context.
Yeah.
So absolutely number one is maintaining strict patient confidentiality.
Non-negotiable.
Non-negotiable, avoiding any unauthorized access to data, and having a responsibility to promptly report security risks or breaches if you see them.
Those seem foundational. What about broader ethical ideas?
We always have to balance key principles. Patient autonomy, respecting their choices about their data. Beneficence, making sure the technology actually does good and helps the patient. And justice, ensuring fairness, especially around access to technology and information. We need to avoid creating digital divides.
Using tech for good, fairly, and respecting patient choice. What's the ultimate goal here, ethically speaking?
The ultimate goal is always to ensure that these informatics systems support and enhance safe, ethical, high-quality patient care, not get in the way of it. Technology is a tool, and it needs to serve that primary purpose.
Makes sense. Now, the notes mention a specific framework for tricky ethical situations, the moral model. Can you walk us through that?
Yes, the moral model. It's a really practical, step-by-step way to think through ethical dilemmas that pop up in informatics.
Okay, MORL. What's the M?
M is for massage the dilemma. Basically, gather all the facts, understand the situation completely before you jump to conclusions. Who is involved? What are the specifics?
Got it. Get the full picture? O.
O is outline the options. Brainstorm all the possible actions you could take. What are the different paths forward?
Okay. Then R.
R is review ethical principles. Look at your options through the lens of ethics. Those principles like autonomy, beneficence, justice, and also professional codes, legal rules. Which options align best?
Analyze the choices ethically. A.
A is act, make a decision, and implement the chosen course of action.
And finally, L.
L is look back and evaluate. After you've acted, reflect on it. What was the outcome? What did you learn? Could it have been handled differently? It's about continuous improvement.
Massage, outline, review, act, look back. Seems like a solid process. What kind of informatics dilemma might this help with?
Oh, lots of things. Maybe you discover a potential glitch in the EHR that might affect patient safety. How do you report it? Or someone asks for access to data, but you're not sure if their reason is legitimate.
Tricky.
Or even balancing the pressure for quick documentation versus being thorough and accurate. The moral model gives you a structure to work through those gray areas.
That's really useful. Okay, last big topic. Home telehealth. Healthcare moving into our living rooms. What are the unique legal, ethical, and regulatory issues there?
Telehealth definitely adds new layers.
Yeah.
Legally, informed consent is critical and needs to be really specific about remote care, explaining the technology, the privacy measures in the home setting.
Right, it's different from being in a clinic.
Very different. There are also potential cross-state licensure headaches. Can a nurse licensed in one state provide telehealth care to a patient in another? The rules can be complex.
Yeah, state lines matter.
They do. And importantly, the documentation standards are exactly the same. A telehealth visit needs the same rigorous charting as an in-person one.
Okay, legal points noted. What about ethics in the home setting?
Ethically, protecting patient dignity and privacy in their own home is huge. You might see or hear things you wouldn't in a clinic. Sensitivity is key. We also have to consider digital health literacy. Does the patient know how to use the technology? Do they need extra support?
Good point. Not everyone's tech savvy.
Exactly. And a major ethical concern is avoiding disparities. Does everyone who needs telehealth have access to reliable internet and the right devices? We can't let telehealth widen the gap between the haves and have-nots in healthcare.
Ensuring equity, that's vital. And what about regulations for telehealth?
Well, all the usual rules still apply. HIPAA, ATEC, state privacy laws are paramount. You absolutely must use secure, encrypted platforms for communication and data storage. No shortcuts there.
Security first.
Always. And comprehensive staff training is essential not just on the tech, but on specific procedures for remote monitoring and, crucially, what to do in an emergency during a telehealth visit. You need clear protocols.
So even though it's remote, the standards for safety and security remain just as high. Okay, we have covered a ton of ground today, from basic data security up to telehealth rules. If you had to boil it down, what are the main takeaways?
I'd say first, protecting health data is complex. It needs multiple layers: tech, policy, people. Second, laws like HITech really shifted the landscape towards stronger enforcement and patient rights. Third, EHR use has evolved from just adoption to driving quality care. Fourth, the legal and ethical lines around EHR's ownership and privacy are critical for everyone to understand. And finally, new areas like telehealth bring unique challenges that need careful attention.
It's definitely a lot to keep track of, and it seems like it's always changing, but understanding this is just so important, whether you're providing care or receiving it.
Absolutely. And, thinking ahead, as technology keeps racing forward, what new ethical or legal challenges do you see coming down the pike in the next, say, 10 years regarding our health data? And maybe more importantly, what can we start doing now to prepare for them? It's worth thinking about your own expectations for how your health information is handled.
That is a big, important question to leave folks with. Thank you so much for breaking all of this down for us today. It's been incredibly insightful.
My pleasure. It's crucial stuff.
And for everyone listening, if this deep dive sparked your interest and there are other areas of healthcare informatics you're curious about, do let us know.